Hello, my name is Andrew Brock, and I am an assistant professor in the gastroenterology division at the Medical University of South Carolina in Charleston, South Carolina. I would like to thank the editorial board of gastrointestinal endoscopy for inviting me to present my recently accepted manuscript entitled Endoscope Storage Time, Assessment of Microbial Colonization 21 Days After Reprocessing. This study was conducted in collaboration with my co-authors, Dr. Lisa Steed, Janice Freeman, Bernadette Gary, Phyllis Malpass, and Dr. Peter Cotton. We conducted this study due to a paucity of data on how long endoscopes may be stored after reprocessing, which has led to wide variation in storage times and a recommendation of no recommendation by United States multi-society guidelines. Furthermore, the Emergency Care Research Initiative, also known as the ECRI, which is a nonprofit aimed at research to improve healthcare quality and safety, named inadequate reprocessing of endoscopes and surgical instruments as a top 10 technology hazard for 2014. We thus felt this was a timely and important study. Endoscopes are reprocessed or cleaned to prevent transmission of infection from one patient to another. Since the implementation of standard reprocessing protocol in 1988, transmission of infection has become a very rare event, and reports have been limited to breaches in disinfection protocol or the use of defective equipment. How long instruments may be stored before microbial colonization occurs, however, is not presently known. This has led to wide variability in reprocessing intervals amongst institutions, with some in the United States being as short as 5 days. Other societies, such as the Gastroenterological Society of Australia, call for even more stringency, with reprocessing recommended after 12 to 72 hours. The few studies that address this issue indicate that shelving instruments for 5 to 14 days is associated with a low risk of contamination, with one small study of colonoscopes only showing this for up to 8 weeks. The objective of this study was to demonstrate whether duodenoscopes, gastroscopes, and colonoscopes may be stored for up to 21 days without microbial colonization by potential pathogens. We conducted this prospective observational study at the Medical University of South Carolina from August to October of 2013. We took 4 duodenoscopes, 4 colonoscopes, and 2 gastroscopes out of circulation and reprocessed them per institutional protocol in accordance with published guidelines, utilizing high-level disinfection with an automated reprocessor. Immediately after reprocessing, microbial samples were collected from the suction channel, biopsy channel, and elevator wire channel for duodenoscopes. This served as day 0. The scopes were then stored hanging in a ventilated cabinet, and samples were again collected in the same fashion on days 7, 14, and 21. Samples were obtained in 1 milliliter aliquots and inoculated onto standard microbial media, and organisms were identified using standard microbial techniques. We found 33 positive cultures from 28 of the 96 sites tested, making for a 29.2% overall contamination rate. 29 of these 33 cultures were typical skin or environmental contaminants. The most common of these was coagulase-negative Staphylococcus, followed by Micrococcus, Bacillus, Corynebacterium, and Propionibacterium acnes. Only 3 of these cultures grew more than 1 colony-forming unit per ml, and only 1 microbe was cultured from the same channel of the same scope at different time points. Thus, these microbes were felt to be clinically insignificant and likely due to contamination while obtaining and/or inoculating samples. 4 of the 33 cultures represented potential pathogens. These included Enterococcus, Candida parapsilosis, alpha hemolytic streptococcus, and Oreobasidium pullulans. All were found in low concentration and at only one time and site. Thus, none were found on repeated cultures at the same or other sites. Furthermore, none of these pathogens has been documented in prior reports of endoscopically transmitted infection. Because of this, we felt these were also likely clinically insignificant. This is the first study to evaluate colonization of duodenoscopes, colonoscopes, and gastroscopes for up to 21 days after reprocessing. While we still do not know what the maximum shelf life is before microbial colonization occurs, there is now evidence that we can go beyond the 5 to 7 days that is practiced in many units. This always comes with the disclaimer that this safety can only be assured if reprocessing guidelines are followed rigorously, and it is not known whether this applies to reprocessing systems and disinfection agents that are different from the ones we used. Longer endoscope storage times could lead to a substantial cost savings in terms of technician time, use of disinfectants, processors, and other equipment, and avoidance of potential delays in endoscopy should scopes not be available for use. Future studies are necessary to determine whether reprocessing intervals could be extended beyond 21 days. On behalf of my co-authors, I would like to thank the editorial staff of GIE for allowing us to present this work.